Hey, everybody, welcome to a new episode of Ask Dr. Barry. One of the most common questions that we get about the use of medical cannabis, and especially in the nursing home atmosphere, right? Or especially in the environment where you do have a significantly debilitated patient who may come in on a list of medications, right? People are always worried, of course, about drug-drug interactions, right? Will there be an additive effect or a less effect? Will the drug levels go up or down, right? How can I safely diminish my use of pharmaceuticals when I'm starting medical cannabis? So it's really important to know that when it comes to those interactions, right? And we're finding that this is really an issue in the nursing home atmosphere. For example, when you have a patient who may be on a list of medications, the nurse is going to be very cautious, of course, as they hand out those medications in the nursing home environment, not wanting to interfere with any of the other medicines that the patient may be on, or quite frankly, that's any caregiver. Let me give you the great news about cannabis. Very minimal, and you can't say none, but very minimal drug-drug interactions. The most important drug-drug interaction that literally every cannabis clinician knows about and should be looking for on every chart that they start a patient on, medical cannabis is Coumadin or warfarin, one of the most common of the blood thinners because of an effect in the liver on the enzyme system there. The elevation of the INR, as it's called, or the number that we watch for the coagulability, right, can go up, right? This doesn't mean that patients can't use medical cannabis when they're on Coumadin or warfarin or, quite frankly, any other blood thinner. But you need to be cautious. You need to check that INR more frequently. You need to see what effects cannabis has on you specifically. And then your doctor can adjust your dose, right? The other blood thinners, even aspirin or Plavix or any of those, Brilinta, those all don't have significant additive effects on the hypocoagulability, but may have some slight effects. But the good news is really there's a few seizure medications, Onfi being one of them, but very unusual to have really any elevation or lowering of the drug levels in the system because of the use of cannabis. Now, there is the enzyme system in the liver, cytochrome P450, for those of you that want to look it up. But the bottom line is there is some interactions, but in general, it doesn't come into clinical play. Every doctor should review your medicines with you when you start a medical cannabis program to look for those potential interactions. And listen, you should be conscious of your body. And if you feel that you're having some side effects that may be due to the interaction between your medications, of course, that's something that you want to talk with your doctor. But the good news in general, and this is the most important factor, is that there's no interaction with cannabis and the mu receptors, right, in the brainstem. That's what controls your breathing, your heart rate, all those other vital functions. That's why people will die literally of a narcotic overdose, an alcohol overdose, a benzodiazepine overdose, right? Alone or in combination, because they all affect those mu receptors in the brainstem. But the CB receptors that react to cannabis don't contribute to any of that effect on the respiratory state of anybody. And that's why nobody dies of cannabis. The only way you die of cannabis, as I like to say, is if you're smuggling out of somewhere and it hits you coming out of the plane, the bale of cannabis breaks your neck. Other than that, safely, cannabis can be integrated into literally anybody's other medication regimen, right? And the best way to reduce your other pharma meds is in conjunction with your doctor, upon discussion with him, never 2 meds at a time, never anything abruptly. So a good common sense approach can achieve that. But when it comes to drug-drug interactions, the good news about cannabis is that in general, it's a very safe and easy process to add cannabis to other medical regimens.